So Dan and Tom approached me separately initially, both with the same topic in mind, which was about the Trust doing more for patients at risk of death from severe sepsis. It was a topic, an area of practice that they were both very keen to explore more, and they'd done huge amounts of research and felt that the Trust really needed to take it seriously. So they approached me on several occasions, asking, why weren't we doing more, and their courage and their commitment to the area, to sepsis itself, has led to the formation of what became essentially a task force, which in turn led to the development of the Code Yellow sepsis pathway, which has been a huge success in our region. So the benefits to patients from the work that Dan and Tom have been so closely involved with means that we've now developed a screening tool for our staff to use for patients who are at risk of severe sepsis. Prior to this work, there was no systematic way of assessing patients with minor infections to see whether or not that infection was affecting them severely. So now, since the introduction of the Code Yellow pathway, we have screened nearly 10,000 patients through the process, and we've identified many hundreds of patients who previous to this wouldn't have been identified and wouldn't have been treated optimally. So one of the key benefits is how quickly those patients are taken to hospital and how quickly the hospital can then give them antibiotics. So I'm very grateful to Dan and Tom for pushing the sepsis agenda within the organisation. And in fact, it's meant that we really started work a whole year before we were required to. The month where we went live with Code Yellow, a patient safety alert was issued by the Department of Health, mandating organisations to provide a screening tool. And of course, we were there pretty much at the same time with a screening tool that was being rolled out at that point. So Dan and Tom's contribution really allowed us to start work a year before anyone else was. It's certainly in terms of providing a definitive screening tool for ambulance clinicians to use in a pre-hospital setting. So I was really pleased and proud to hear that the nomination I'd made for Dan and Tom had been accepted and that they were to receive the Chief Executive's commendation. They're a very diligent pair, very, very professional, and gave loads of effort to this project and still do in an ongoing way. So I want to say well done and congratulations to them both.